Okay, thanks to everyone who's joined us. We're just going to wait a few minutes until 2 o'clock and we'll start right at 2. Okay, we're more people slowly trickling on. Thank you for joining us. We'll be starting shortly. We're glad you're with us here today. Okay, we're going to get started in just about a minute. Thanks for joining us. Make sure you can access the chat if you need to send us a message or any questions as it goes along. As you see on the screen right now, it kind of shows the phone option call-in information in the chat window. So get yourselves comfortable and we'll be starting shortly. All right, thank you for your patience. We'll get started in just 1 minute. All right. Hello and welcome. Thank you for joining us today. My name is Mara Quitas, and I'm the Education Coordinator at Lifespan. I'm also your host for today's program, Navigating End-of-Life Care, Dementia Care. I'd like to welcome you on behalf of Lifespan. I'm going to take just a brief moment to tell you about Lifespan, then go over some quick housekeeping before I turn it over to today's presenter. Lifespan is a regional nonprofit organization dedicated to helping older adults and caregivers take on the challenges and opportunities of longer life. Next slide. We provide information, support, and guidance through more than 30 services. All of our services are provided in Monroe County, and some are provided in the outlying Finger Lakes region and across New York State. If you have an aging or caregiving issue, call Lifespan. We're here to help. Today's presentation is a part of our Caregiver Education and Wellness webinar series, sponsored by the Finger Lakes Caregiver Institute at Lifespan, funded by a grant from the New York State Department of Health. We're offering these caregiver education and wellness webinars on a fairly regular basis, so please check our website. Our next week's topic is Addiction and Alzheimer's, presented by Ann Olin, the Program Manager of the Geriatric Addictions Program at Lifespan. For information on that and for other events and programs, please visit our website at www.lifespanrochester.org. Before we begin, a few housekeeping items. All attendees are in listen-only mode. If you have a question or comment, please use the chat window. You'll see there are two sections to write a question. There's either questions or chat, so type into either, and we will respond to all questions at the conclusion of the presentation. So now let's welcome today's presenter, Kat Carr, LMSW and Care Manager here at Lifespan in the Finger Lakes Caregiver Institute. She also serves as a board member at the Shepherd Home, a local comfort care home. Thank you for being here, Kat. Take it away.
Thanks, Mara, for the introduction. So I'd simply like to start by thanking everyone who was able to join me in having this conversation today. While end-of-life care is a true passion of mine, I fully recognize and acknowledge that death and dying is incredibly difficult to talk about. In the context of dementia, we're witnessing someone we love slowly change over the course of days, months, and oftentimes years. You may have heard the term the long goodbye, and this truly captures the essence of what we experience as our loved one changes over time. So you may wonder why I'm using the word we as I talk. So on December 18th, 2018, my Uncle Douglas died from complications due to Alzheimer's disease. As you can see, Douglas also had Down syndrome. This photo was taken by my mother on Thanksgiving that year in the nursing home where Douglas resided for the last year and a half of his life. While life will truly never be the same without Douglas, His journey with dementia and ultimately his death has taught me so much about the value and importance of providing comfort during the last months, weeks, days, and hours of life. I genuinely believe that dying is a very sacred time, and being afforded the opportunity to accompany Douglas on his journey is one that I will be forever grateful for. I hope that the information that I will be sharing with you all today will help guide you as well as your family in providing comfort to your loved one throughout their journey. So, as we know, dementia results from a variety of diseases and injuries that primarily or secondarily affect the brain, such as Alzheimer's disease or stroke. The progression of dementia depends greatly on the underlying cause of the dementia. While people will experience dementia differently, most people with dementia share some common symptoms. Over time, people with dementia will gradually become more frail, have more frequent falls or infections, become less mobile, sleep more, as well as eat and talk less. I don't need to tell you all that caring for someone with dementia can be incredibly stressful and overwhelming. It can be difficult to see the changes in your loved one because dementia often progresses slowly. You might even get used to the slow decline or new normal. Over time, you begin to do more and more without even realizing it, and then you find yourself pretty exhausted. To help support you as well as your loved one throughout their dementia journey, palliative care should be a key part of your support team. The Center to Advance Palliative Care defines palliative care as specialized medical care for people with serious, chronic, or acute life-threatening illnesses. This type of care is focused on providing individuals with relief from symptoms, including the pain and stress of a serious illness, assistance with medical decisions, and establishing goals of care, whatever the diagnosis. Palliative care is provided by specially trained team of doctors, nurses, and other specialists who work together with your loved one's doctors to provide an extra layer of support. Palliative care is based on your loved one's needs, not their prognosis. Palliative care is delivered throughout the course of an illness, along with both curative or life-prolonging care. Therefore, palliative care is provided by many different types of providers in a variety of settings, including hospitals, nursing homes, home health care agencies, and concludes with hospice care when life expectancy is limited. The palliative care team helps to improve your loved one's quality of life. They do this by providing expert symptom management, extra time for communication about goals, help navigating the healthcare system, and supporting you and your family. Palliative care helps treat some of the symptoms that arise from dementia, such as depression, anxiety, and difficulty sleeping. It can also teach both you and your loved one about what might trigger some behavior symptoms and how to avoid them. Palliative care can be started at any time after a dementia diagnosis, but the sooner palliative care can become involved, the better, as the palliative care team can work as part of your loved one's support structure from the very beginning. The team also focuses on conversations about concerns, what is important to you and your loved one, how and where your loved one may want to be cared for, and what level of care they may want in the future. As dementia progresses, palliative care can help you as you plan to care for your loved one either at home, in an assisted living facility, or a nursing home. Keeping your loved one safe is critical. The team can give you guidance and help you cope with these concerns, and later with making decisions about feeding difficulties, infection, hospitalization, and the best place for your loved one to be cared for. Although dementia is difficult, when palliative care is involved, some of the burden of care is eased and the best quality of life for your loved one is achieved. It can be difficult to know exactly when an individual with dementia is close to the end of their life. Due to the variable nature of dementia's progression, a person with later stage dementia often deteriorates slowly over many months. While each individual journey with dementia is unique, we generally see that the person gradually becomes more frail and needs more help with everyday activities such as eating, dressing and washing themselves, as well as using the toilet. People may also experience weight loss as swallowing and chewing becomes more difficult. As your loved one continues to decline, hospice care is specifically designed to benefit your loved one in the final stages of their dementia journey, as well as you and your family. Hospice care is medical care to help someone with a terminal illness live as possible for as long as possible, with a terminal illness live as well as possible for as long as possible, increasing their quality of life. Like palliative care, hospice provides comprehensive comfort care as well as support for the family. But in hospice, attempts to cure the person's illness are stopped. Hospice care addresses changes that occur to the whole person as they approach the end of their life. There is an emphasis on comfort by providing relief from physical suffering throughout pain and symptom management. Hospice care also addresses the needs of the entire person, including physical, mental, emotional, social, and spiritual dimensions. Hospice care is a person and family-centered approach that includes, at a minimum, a team of doctors, nurses, home health aides, social workers, chaplains, counselors, and trained volunteers. They work together, focusing on your loved one's needs, whether physical, emotional, or spiritual. The goal is to help keep your loved one as pain-free as possible, with family and friends nearby. The hospice team develops a care plan that meets your loved one's needs for pain management as well as symptom control. The services provided by the hospice team depend on what the hospice patient and the family need, which services your loved one receives, and how often services are received are based on the needs of your loved one and family. The services that are provided can be adjusted as the situation of your loved one and family change over time. Among its major responsibilities, the interdisciplinary hospice team provides a hospice physician who works with your loved one's personal physician to develop a treatment and care plan. A hospice nurse or a nurse practitioner is assigned to assist your loved one with pain and symptom control and to monitor their changing needs. For those receiving hospice care at home or hospice care in a facility, the hospice nurse visits at least once a week and more often if needed. A hospice nurse is on call 24 hours a day, 7 days a week, to give your loved one and family support and assistance whenever needed. A certified home health aide or licensed vocational nurse visits your loved one 2 or 3 times a week to assist with bathing and personal care. A hospice social worker provides emotional support and counseling for your family, as well as provide information about other community resources. Many hospices also have a dietitian on staff to provide patients and families with nutritional counseling as needed. If ordered by your loved one's physician, physical as well as occupational therapy services to manage symptoms related to the terminal illness are provided through arrangements with contracted agencies or individuals. Speech language pathology is a specialty focusing on the evaluation and treatment of communication disorders, voice disorders, and swallowing disorders, which, as I mentioned earlier, often can occur following either a stroke or are the result of other neurological diseases such as Alzheimer's disease. Speech language pathology therapy services are provided through arrangements, again, with contracted agencies or individuals to help manage symptoms related to the terminal illness if ordered by a physician. The hospice chaplain can be a minister of any faith, and his or her goal is to improve spiritual consolation and guidance to your loved one and family. The hospice chaplain typically visits within a week of the initiation of hospice care to complete a spiritual assessment and meets with you and your family to assess needs and concerns. The participation of a chaplain in the treatment plan is entirely up to you and your family. Hospice grief and bereavement counselors provide support and counseling to families as needed. Support groups and classes are also offered for adults, teens, and children. Families have access to grief counseling and bereavement support for 13 months following your loved one's death. Lastly, the types of support provided to your loved one and family by hospice volunteers may include running errands, preparing light meals, sitting with your loved one when you may want to take time for yourself, and lending emotional support and companionship to both you as well as your family. Volunteer schedules are arranged as requested by you and your family. Many individuals and families could benefit from hospice care, but are unaware of how to access such services. Some are afraid to discuss it, some wait for a physician to suggest it, and some don't know that they can actually initiate hospice care on their own as long as hospice eligibility is met. While great advancements have been made in the medical field over the past several hundreds and hundreds of years, estimating how long a person has to live is nearly impossible. In most cases, it simply cannot be done with absolute accuracy, but a general idea is required in order to establish a person's eligibility for receiving hospice care. To receive hospice care, physicians must be willing to state that death can be expected within 6 months. This does not mean that care will only be provided for those 6 months. Hospice can be provided as long as your loved one's physician and hospice team certifies that their dementia remains life-limiting. Additionally, hospice is appropriate when your loved one continues to decline and experiences changes that were mentioned in an earlier slide. Key changes include weight loss, increased confusion, and the inability to perform activities of daily living, including getting dressed, bathing or showering, using the toilet, and physically feeding oneself. Lastly, hospice should become involved when the focus of your loved one's care shifts from seeking treatment hoping to extend life to prolonging the best quality of life as long as possible. Anyone can inquire about hospice services. Most people don't actually realize that. You may call a local hospice program and request services for your loved one. The hospice staff will then contact your loved one's physician to determine if a referral to hospice is appropriate. Another way to inquire about hospice care is to talk with your loved one's physician, and he or she can make a referral to hospice. Regardless of how you inquire about hospice care, your loved one's physician must sign a certificate of terminal illness in order to proceed with hospice enrollment. Hospice can begin as soon as the hospice nurse or social worker visits to make sure your loved one meets hospice guidelines or criteria. The hospice nurse or social worker will also review the services that hospice will offer. Once the necessary consent forms are signed, care can begin. Unfortunately, doctors often wait too long to suggest hospice or wait for families to bring it up. This is part of the reason that people often receive hospice care so late in the process. If you think your loved one and family might benefit from the support of weekly home visits from staff who specialize in pain control and the easing of distress, ask your doctor if hospice might be something to consider now or near in the future. So I'd like to also discuss some signs of approaching death. We, again, often don't like to talk about this. It's very distressing and upsetting, and it's pretty taboo in our culture. Please be aware, though, that this is a very general overview of the changes that can occur during the dying process. Each individual situation and experience is unique and influenced by many factors, such as the particular illness and the types of medications being taken. But there are some physical changes that are fairly common. The physical changes that occur are related to end-stage progressive disease. Essentially, the body is starting to shut down. Such changes may be alarming and appear abnormal. However, these are normal and expected during the dying process. For some, this process may take weeks. For others, only a few days or even hours. Your loved one's appetite and thirst may decrease, and they may have little desire to eat or drink. This may be very concerning to you and your family, but is a natural process and is not painful for your loved one. Sips of water or a moist mouth swab will help them. You can ask the nurses to show you how to help with mouth care. Attempting to feed someone who is unable to swallow may make them distressed. Changes happening in your loved one's body means that they may spend a lot of time asleep. They may be drowsy and difficult to wake up. It is best to talk to the person when they seem the most alert and allow them to sleep when they want to. There's no need to shake your loved one or to speak loudly. It is best to speak softly and naturally. Your loved one's body temperature may change. At times, their hands, feet, and legs may be increasingly cool to the touch. At other times, they may be hot and clammy. Sometimes your loved one's body becomes blotchy and darker in color. This is simply due to the circulation of blood slowing down and is a normal part of the dying process. Too much bedding may make your loved one hot and restless, so you may want to use a fan to circulate the air, as well as cool, damp towels can help if your loved one seems pretty hot. The amount of urine that the body is producing does decrease due to the amount of fluid that your loved one is drinking. The urine may become stronger and darker in color. You may wish to use pads and special absorbent sheets to enhance comfort and hygiene if your loved one has lost control of their bladder as well as bowels. A member of the hospice team will advise you about what's needed. As coughing and swallowing reflexes slow down, saliva and mucus may collect in the back of your loved one's throat, causing a gurgling, bubbling, or other noise. This noise can be concerning, but does not usually cause too much distress to the person. You can lift your loved one's head and support them with pillows so that their head is turned to one side. Medications can also be given to slow down the production of saliva and mucus and thus improve comfort. Regular breathing patterns may also change. Sometimes your loved one's breathing may be fast, and at other times there may be long gaps between breaths. Breathing may also be shallow or noisy. This, again, is also due to blood circulation slowing down and a buildup in the body's waste products. It is not painful or distressing for your loved one. Due to the decrease in circulation of blood to the brain and to other changes happening in the body, your loved one may become restless or agitated. To have a calming effect, speak in a quiet, natural way. Lightly massage your loved one's hand or forehead, or softly play familiar music. Let a hospice team member know if the person becomes restless or agitated. Medications can be given to reduce the problem. In addition to helping you in recognizing the signs of the dying process, the hospice team will help you with the physical and emotional demands of caregiving. Nurses will be able to adjust medication and care plans as your loved one's needs change. Aides can help with bathing, grooming, and other personal care. Social workers can help organize resources for your loved one and your family. Chaplains and bereavement specialists can help you and your family with any emotional or spiritual needs. The following resources are among the numerous organizations and websites dedicated to providing information and education about palliative care, hospice, and the dying process. And Mara will kindly share these slides, including these helpful resources for everyone at the end of the presentation later today. I would like to end this webinar with a quote from Dame Cicely Saunders, the founder of the first modern hospice. You matter because of who you are. You matter to the last moment of your life, and we will do all we can, not only to help you die peacefully, but to also live until you die. Thank you everyone for joining me this afternoon.
Okay. Thank you so much, Kat. So thank you all for being with us today. We can now take questions, so please send them in chat. I've gotten a few privately. As Kat mentioned, the slides will be shared in a follow-up email with you all in a PDF, so I'll send that to you this afternoon. We also ask that you fill out our survey, and I will send that in the chat shortly, and then as you see, the link is up there on the screen right now. It'll also be in the follow-up email. So first question I had was, why is hospice support 13 months?
That's a really great question, and to be perfectly honest, I don't know why that specific number has been chosen. I can surmise that hospice provides comfort and support for both those 6 months or maybe longer of your loved one's dying journey. But they also, as I had mentioned, provide bereavement support, support groups, different classes to you as the caregiver, but to your family members. So hospice, once your loved one passes away, they don't just stop and say, okay, we're done. They continue to help support you. So I would imagine that the 13 months is just because it's a little after a year of your loved one's passing. But again, I'm not 100% positive on that.
Yeah, and there was a clarifying comment of just, yeah, I was referring to why is it 13 months after someone dies. And from my experience as well in working in hospice, they want to be with people through the 1 year anniversary of the death. So that's why it's 13 months of bereavement services. Um, all right, we have another question that has just popped up. Let me see, I'm just expanding it to see it better. Does insurance cover hospice?
Great question. And I did mean to put this in there and it totally slipped my mind. So yes, insurance does provide coverage for hospice care completely in full. Um, Most often when we're talking about older adults with dementia, we're going to be looking at Medicare, which does have a hospice benefit. And again, will pay for the hospice care and services in full. Just kind of a clarifying point to that, if your loved one is residing in a skilled nursing facility or a nursing home, hospice does not cover for your loved one's room and board. Hospice, again, just simply provides that extra support for your family as well as your loved one. But yes, hospice is paid for by health insurance. If someone is younger, people can also receive hospice services. Most private insurance companies have a hospice benefit as well as Medicaid.
Thank you. We have just a comment here. Thank you. For me, this is just on time. I'm helping a friend that is in hospice. Next question, how do I know which hospice program to use?
Another really great question. So in the Rochester and Finger Lakes region of New York State, there are two hospice programs. One is UR Medicine Home Care, which is with UR Medicine. The other is Lifetime Care. And for the most part, they provide all the same services. Usually it's just kind of the consumer's choice. Let's say maybe all your medical providers are with the U of R system and you simply want to stick with the U of R, so you choose UR Medicine Home Care. Other people may have had, let's say, home care services returning home from a hospitalization or a rehab stay and had Lifetime Care come in to do some transitional home care, nursing, PT, OT. They might have had a great experience and just decide to choose Lifetime Care. If you were to simply just Google UR Medicine Home Care Hospice and Lifetime Care, both websites have a plethora of resources and break down what services are provided, a lot of which is what I reviewed with you all today. But again, they're pretty much the same. So a provider will simply just want to know what your preference is. But I definitely would strongly encourage you to look at their websites just to get a better feel if that is something that you feel, I don't know what agency to choose.
Thank you. So for individuals with dementia, is increased aggression a normal sign as they come to the end of their life?
So it's tricky because we know that, no two people with dementia are alike. So what one person might experience might be the total opposite of another. And some people might experience aggression and agitation earlier in their dementia progression, whereas others might experience that later as their dementia continues to progress. Also kind of depends too on, are there other underlying health conditions that the person has, maybe COPD, for example, or underlying heart problems. So can also depend too on that, medications that they're taking. I wish that we all had that like crystal ball that we could look and see what that end of life experience for your loved one is going to be, and we don't have it. So some people might continue to experience that agitation and aggression towards the end, and it could definitely be a sign, as I mentioned earlier. People can tend to experience that towards the end, but they also will be experiencing some of those other symptoms that I mentioned as well. I think that one of the key things in regards to that question that you had asked is to speak with the primary care physician and just closely be in communication with them about things that you're seeing, maybe concerns that you're having, and they'll be able to help walk you through all of that.
Okay. How do I choose hospice at a hospice place or at my home? What kind of some of the factors that go into that decision?
So, hospice care, as I mentioned earlier, can be provided in a variety of different settings, whether that's within your home, could be in an assisted living facility, could also be in a nursing home. There are in New York State what are called comfort care homes. And in our area, I believe there are 13. So we are very rich in that resource, I should say. So in regards to a comfort care home, these are 2-bedroom houses that look just like a house you or I would live in, and they can provide care for 2 individuals who doctors have deemed have 3 months of their life left to live. Um, these houses are totally run by volunteers. So when hospice may send a referral to a comfort care home, usually it's the nurse and the executive director of the home are going to come out, meet with you and your loved one, and really determine what a comfort care home be a good fit for them. You can have your loved one again receive hospice in a nursing home. I think there's a lot to consider if your loved one is already living at home and then starts hospice care and you're looking maybe at placement in a nursing home. Would that move, could it be more risky than beneficial? Totally just depends on what's going on with your loved one. Having, again, those close communications with your loved one's doctor, the hospice team. Hospice, if it's in the home, again, hospice does not provide 24/7 home health aid services. It's usually only a few hours for maybe 5 days a week. It's not designed to be 24/7. So if there are other family members, friends, neighbors, if you have a huge support team that can help provide 24/7 support, then maybe hospice at home would be okay. If not, then maybe it's looking at an alternative setting. So it's so individualized, but those I hope help walk you through some of the other options that people can have.
Thank you. So what recommendations do you have in explaining to other family members the benefits of hospice? They think it means that I want my mom to die and then I'm giving up on her.
So that definitely is a myth still in our society that hospice means I'm giving up. Hospice means, like you had said, I want my mom to die. That couldn't be farther from the truth. Hospice really is, I kind of like in my mind, I'm a very visual person. I look at hospice as just like giving you and your loved one a big hug and just wrapping your arms around them and just providing that support. Dying can, again, it's incredibly hard. It's something we don't like to talk about. So I think that's part of why hospice has such a bad connotation. But death can also be really beautiful. In regards to when I started talking about my uncle, yes, that was hard. He was one of my favorite people on this planet. But with those additional supports around both him as well as my family, we were able to be there with him. And that's something that was such a gift. And I will forever be thankful for. But again, it's such support. It's not, here is morphine and that's going to kill your mother. That's not what happens. So I think too, a lot of just education and sharing, these are the facts about hospice. Hospice can start a lot sooner than people usually start to receive it. And it can just, I could talk forever about it because it's just such a passion of mine. But I think looking at the facts, looking at maybe statistics, if someone you're talking to is more, wants certain facts in that regard, but just again, talking about, what a gift and a blessing that it can be for both your loved one, but also you and your family. I hope that's helpful.
Thanks. So we have just a comment, like, can you talk a little bit about COVID-19 and as it relates to hospice and nursing homes? That's all it says. I'm wondering if this is referring to, um, with nursing homes having restricted visitors, are we able to visit people on hospice at a nursing home?
So that is a really wonderful question that I don't know too much about right now. It's my understanding that hospice is still being provided to individuals in nursing homes despite the restrictions given the COVID-19 pandemic for family members, friends, close people to the person who is dying. I don't really know too much about what that visitation looks like, but I can speak to the people that are coming in, so the hospice nurse, social workers, the aides. It's still all happening following all of the COVID-19 precautions and PPE requirements. So I'm sorry I don't have too much more, but I could do some research and maybe send that to Mara and she can share that out to folks too.
Thank you. Yeah, and I'm not entirely sure either. Like I've heard some things, I think it like might vary a little bit by nursing home, but I know of like one place that as restrictions have eased up a little bit, like if someone is, if they believe they have, that their dying is pretty imminent, family can come into the nursing home, but I'm not sure full details on that. And I think it does vary on nursing home. So to talk with the social worker at the nursing home, give them a call. And also, if you're working with a hospice team, they can help you navigate that. Okay. And then any more that you could share about hospice homes outside of UR Med and lifetime care?
So the hospice homes are not actually affiliated with UR Medicine Home Care or Lifetime Care. Again, those two hospice programs in the area. These hospice homes are completely independent from the hospice agencies, so they're just completely separate. So regardless of what home maybe your loved one is in, whatever hospice organization you guys decided to work with, just like in a nursing home, that hospice team would follow your loved one, just it's a different setting. So I hope that clarifies, and if not, maybe we can help clarify a little more.
Thanks. Um, One more question. Have I heard that there are various services that accompany hospice, spiritual, music, etc.?
Yeah, so there are lots of different things. So really, again, tailored to your individual or to your loved one's individual needs. So that might be, music therapy or massage therapy, doing maybe like hand massages that maybe the home health aides can do. So again, that's why I think one of the big benefits of hospice is because it is so individualized based on what's going on with your loved ones. What did they like? What did they dislike? What music maybe did they find comforting or enjoy? So lots again of that individualized tailored support, really just to continue to provide that comfort and make the end of life not as distressful as I think our society thinks that it is.
Um, Someone says, I think in a hospice home there's 24/7 attention by either volunteers or professionals. That might be an advantage over home hospice, where maybe family might be limited or stressed.
Yep. So the hospice homes or the comfort care homes are staffed 24/7 by volunteers. They usually have an on-call nurse, as well as, again, that whole hospice team that can come and help support. So that could definitely be an advantage because they are run pretty much solely on volunteers. If someone is at the end of their journey and maybe is wandering, that might not be the most appropriate setting. But again, it's having that conversation with the one hospice team as well as the comfort care home that you're looking at, because they'll be able to meet with you, do that assessment, and determine if that would be the most appropriate for your loved one. So yes, that definitely could be a benefit.
Yeah, and I just keep thinking as you're answering these questions of how it just really relates to that last slide you shared, the quote of from Cicely Saunders, like, which just hospice really is a gift that helps people live at the end of life and have good quality of life. Um, so it looks like we don't have any more questions. If you have, I'll take a couple more minutes. It's before 3. So if you have a question, feel free. I'm sending right now in the chat the link to the Survey Monkey. If you could please fill this out at your earliest convenience, we really appreciate your feedback. This will also be sent to you in the follow-up email, as well as Kat's slides that have the additional resources. As you'll see in the slide that's up, uh, please consider a donation to Lifespan if you are able. We know this is, a difficult time for many, but if you are able to spare, we'd really appreciate it. And there are a few options on the screen of how to support Lifespan, whether that's online, www.lifespanrochester.org/donate-now. It says up there the Lifespan-ROCH, ROCH. You can access it either way, our website. You can call us by phone with credit card information, send a check in the mail, or Venmo at Lifespan-ROCH. So thank you all so much for being here. Thank you, Kat, for your time and sharing your expertise and knowledge. We really appreciate it. And we hope you all have a wonderful rest of your day and a good end of August. And we hope to see you at more of these webinars that come up or any of our upcoming classes, events, and social activities that are on the docket. So please visit our website at www.lifespanrochester.org. Thank you.
Thanks, everybody. Take care.